Poppy Guy says an unusual change in her skin helped connect months of vomiting, dizziness, and declining strength to Addison's disease, a rare disorder involving the adrenal glands. The 29-year-old mother from Cornwall says ChatGPT listed the condition as one possible explanation, but that was not the diagnosis. The medical confirmation reportedly came later, after she collapsed at home, lost consciousness, and was taken to a hospital during an adrenal crisis. The latest public account says she survived, spent 2 weeks hospitalized, and is now undergoing physical rehabilitation. What remains unclear is why the condition went unrecognized for so long, and exactly what doctors found when she was finally tested. For verified entertainment and human interest updates without the rumors, subscribe to Startline Entertainment. Guy's story begins in July 2025. According to the account she gave Kennedy News and Media, she began noticing patches of increased pigmentation on her arms. At around the same time, she was waking up with nausea and vomiting in the mornings. She says she visited doctors several times during the following months and was repeatedly told that anxiety might explain what she was experiencing. No medical records or statements from the clinicians involved have been made public, so that part of the timeline remains Guy's personal account, rather than an independently documented review of her care. By the period between January and May 2026, she says the symptoms had become much harder to ignore. Standing made her severely dizzy. Her vision appeared unstable. She was vomiting several times a day, and ordinary walking left her short of breath. These complaints may sound disconnected, but fatigue, muscle weakness, loss of appetite, weight loss, abdominal symptoms, and low blood pressure are all recognized features of adrenal insufficiency. Dizziness after standing can occur because blood pressure drops, while nausea and vomiting may worsen as the hormonal deficiency becomes more severe. The most visible change reportedly came during a family trip to Málaga, Spain, beginning around May 25th. Guy said the family had been comparing their tans, but her skin became dramatically darker than she expected. She described her abdomen as extremely dark and said the color looked unlike her normal response to sunlight. The language about becoming nearly black comes from Guy's own description. Medically, the relevant term is hyperpigmentation, meaning areas of skin become darker because of increased pigment. Hyperpigmentation is a known sign of primary adrenal insufficiency, the category that includes Addison's disease. When damaged adrenal glands cannot make enough cortisol, the body attempts to stimulate them by producing more adrenocorticotropic hormone, or ACTH. Persistently high ACTH can also activate pigment-producing pathways in the skin, increasing melanin. The darkening can be particularly noticeable in sun-exposed areas, skin creases, pressure points, scars in the mouth, although the appearance varies greatly between individuals and can be less obvious on naturally darker skin. That means the holiday did not necessarily cause the disease. Based on Guy's account, sunlight may simply have made an existing pigmentation change more noticeable at the same time her other symptoms were becoming severe. That is an interpretation consistent with the established medical mechanism, not a conclusion released by one of her doctors. Guy said she began wondering whether the darkening, vomiting, and dizziness were connected. She entered her symptoms into ChatGPT, which reportedly included Addison's disease among a list of possible explanations. She then searched for information about the condition herself and thought the description resembled what she had been experiencing. This is the point where several headlines risk overstating what happened. ChatGPT did not confirm Addison's disease, review laboratory results, or perform a physical examination. According to Guy's own timeline, the system suggested a possibility that she subsequently raised with her general practitioner. A diagnosis of adrenal insufficiency ordinarily requires a medical assessment and blood testing, often including cortisol measurements and an ACTH stimulation test that examines whether the adrenal glands produce an appropriate cortisol response. In other words, the useful part of the AI interaction was not that a chatbot replaced a doctor. It reportedly gave Guy a term she could bring into a medical conversation. The eventual confirmation still depended on clinicians, hospital evaluation, and testing. The exact prompt she entered and the complete response she received have not been published, making it impossible to judge whether the AI also offered other possibilities, advised urgent care, or communicated the risk accurately. After returning from Spain, Guy says she visited her doctor again and directly mentioned Addison's disease. She described herself at that stage as visibly unwell, underweight, and unable to stand normally. Her doctor reportedly arranged an urgent hospital referral, but the appointment had not happened when her condition suddenly deteriorated approximately 1 week later. Guy said she was preparing dinner when she collapsed. Her mother reportedly found her unresponsive, and Guy says she briefly regained consciousness in an ambulance before losing consciousness again. At the hospital, she was told she was experiencing an adrenal crisis and was diagnosed with Addison's disease. One of her doctors allegedly told her that without hospital treatment that day, she might not have survived. Those details come from Guy's interview. The hospital, clinicians, and diagnostic records have not been publicly identified. The seriousness of the reported emergency is medically plausible. Addison's disease occurs when the adrenal glands are damaged and cannot produce enough cortisol and, in some patients, enough aldosterone. Cortisol helps the body respond to illness and physical stress, while aldosterone is important for maintaining blood pressure and the balance of salt and water. A severe shortage can develop into an adrenal crisis involving dangerously low blood pressure, dehydration, vomiting, confusion, loss of consciousness, and shock. An adrenal crisis is a medical emergency. UK guidance recommends immediate hydrocortisone and urgent hospital treatment when a crisis is suspected. Treatment should not be delayed while waiting for diagnostic certainty. Anyone experiencing collapse, severe weakness, persistent vomiting, confusion, or another possible medical emergency should seek professional emergency assistance rather than attempt to identify the cause through an online search. Guy says she remained in the hospital for 2 weeks and received intravenous and oral medication. The latest public account says she now takes 11 tablets each day, uses a wheelchair and walking frame, and can currently walk only about 20 yards. She is reportedly participating in physical rehabilitation because of continuing weakness and reduced mobility. The names and dosages of her medicines were not disclosed, and no clinician has publicly explained whether all of the continuing mobility problems are directly attributable to Addison's disease. Long-term treatment for confirmed Addison's disease generally involves replacing the hormones the adrenal glands can no longer make. NHS and NICE guidance describes glucocorticoid replacement, commonly hydrocortisone, and mineralocorticoid replacement such as fludrocortisone when aldosterone is deficient. Patients are also commonly taught how to increase steroid medication during illness and how to use an emergency hydrocortisone injection. Those are general treatment principles and should not be interpreted as a description of Guy's private prescription. One reason Addison's disease can be difficult to recognize is that its early symptoms often develop gradually and overlap with many more common conditions. Fatigue, appetite changes, nausea, weight loss, low mood, and dizziness do not initially point to one obvious diagnosis. The National Institute of Diabetes and Digestive and Kidney Diseases specifically notes that adrenal insufficiency can be difficult to diagnose in its early stages because the symptoms emerge slowly. That context does not prove that Guy received appropriate care before her collapse, and it does not prove medical negligence. She says her symptoms were repeatedly attributed to anxiety, but no independent clinical timeline has been released showing what symptoms she reported at each appointment, what examinations or tests were performed, or why particular decisions were made. The responsible conclusion is that Guy believes her physical illness was initially misinterpreted, while the available reporting does not contain enough documentation to assess individual clinicians' actions. Her case also illustrates why a change in skin pigmentation should be considered alongside the entire symptom pattern. A darker tan on its own does not establish Addison's disease. Hyperpigmentation can have many causes, and some people with adrenal insufficiency may not notice a dramatic skin change. In Guy's account, the pigmentation became significant because it appeared alongside months of vomiting, severe dizziness, weakness, weight loss, and declining function. Diagnosis still required a hospital evaluation. The public discussion around ChatGPT introduces a second question. How should people use AI when they are worried about unexplained symptoms? This story shows one potentially useful function, helping someone organize symptoms or identify a condition to discuss with a clinician. It also shows the limit. A generated list of possible conditions cannot determine which explanation is correct, rule out an emergency, or replace physical examination and laboratory testing. Calling this a diagnosis by ChatGPT therefore changes the story in a misleading way. Based on Guy's account, the technology offered a suggestion. Guy recognized that the suggestion appeared relevant and took it to her doctor. Medical professionals arranged a referral, and hospital clinicians reportedly confirmed the condition after she collapsed. Those are separate stages, and collapsing them into one dramatic headline gives the AI more credit and more authority than the published timeline supports. The Startline takeaway is that the most important part of this story is not a competition between artificial intelligence and doctors. It is the combination of a patient recognizing that her symptoms were worsening, an unusual physical sign becoming visible, and the need for formal medical testing. Guy's account may encourage people to describe every symptom clearly and seek another medical assessment when their condition continues to deteriorate. It should not encourage anyone to accept an AI-generated condition as a confirmed diagnosis. What changed for Guy was not simply the color of her skin. It was the moment the pigmentation appeared to connect with nearly a year of nausea, vomiting, dizziness, and weakness. The AI suggestion reportedly gave that pattern a name, but the collapse revealed the urgency. As of August 1, 2026, the latest public information says Guy is home, taking daily medication and undergoing rehabilitation after a 2-week hospitalization. There has been no publicly released medical record, hospital statement, or interview with her treating endocrinologist. The precise cause of her Addison's disease, the results of her diagnostic tests, and her longer-term recovery outlook remain private or undisclosed. For now, her story is best described this way. ChatGPT reportedly raised Addison's disease as one possibility. Guy brought that possibility to her doctor, and clinicians later diagnosed the condition during a medical emergency. The warning sign that drew attention was dramatic skin darkening, but the danger came from the full pattern of worsening symptoms beneath it.